Good morning.
Good morning.
I say good morning the same way to my son. Morning. And it's so annoying. If you literally said nope and exit out after hearing me say good morning, at this point, I also don't blame you. Welcome to the Medicare Cafe. Today we are talking about how to market yourself.
Oh, it's 10. It's 10. We have no pre-chat
Well,
here.
to be fair, you and I were kind of gabbing about some stuff because we haven't seen each other the last few weeks.
I know.
You've been busy setting the world on fire with your sales. Okay, so here's what we're talking today about, like, how are some easy ways to continue to market yourself during AEP. You don't need this. Tell me about your day yesterday.
I did have a record day yesterday.
That's crazy.
I got 7 new clients yesterday.
Not even like 7 applications.
No,
7 new clients.
It was 12 applications, 7 new clients. That's awesome. It was a record for me, and I'm really excited because I still have like a jam-packed week.
That's nuts.
I'm really hoping to get to 20 this week.
20 new
clients, yes.
Okay. Break it down.
It could be possible.
How do these people, like, who are they? Were they turning 65? Were they AEPers? Were they retirement? Like,
yesterday was about half and half.
Okay.
But, so, like, during AEP, I think I've maybe used, like, the AEP election period, like, 5 times.
Really?
Like, the majority of my clients are T65 or retiring in January, so there's always a huge influx during AEP.
It's our birthday month, right?
It is.
I'm really excited about that.
Mine's this weekend. When's yours?
Mine's not until, like, the 30th.
Oh,
so
okay.
I got a while.
I was thinking you were closer.
Yeah. So that's nuts. Okay, so how are these people? You've been doing a ton of seminars lately.
Yep.
So are these all follow-ups from seminars?
Some of them are seminars, but the majority are still just referrals from all of my partners. Primarily financial advisors. And then I've gotten a lot of just current client referrals too.
Has your new appointment or your, what's it called whenever you are, like, not appointed, but like you got new letters after your title? With
designation?
Designation. Thank you. Has your designation, do you feel like has any impact on that? What's your designation again?
A registered Social Security Analyst,
okay.
So RSSA.
Okay.
I really got it to help answer my current clients' Social Security questions. But more so, I do that, but it has strengthened my relationships with financial advisors significantly.
So that you can say, like, you can impact for sure.
Yes, because they reach out to me for Medicare and also for Social Security questions. And so that's really where that's come into play. But yeah, they're just strategic alliance referrals. All of them.
So I think that's a really important thing to keep in mind too. When we talk about, like, marketing and building your brand and building, like, this is who I am. Yes, it is for your consumer facing stuff. Yes, it is designed to, like, keep you relevant, get you appointments. But, like, let's not underestimate the double threat of being in front of your clients as well as having the tools and resources to be in front of your strategic alliances and build these relationships. Because it's 2 birds, 1 stone. That's what marketing does, right?
Yeah. I also have made a point to make at least 1 post a day, sometimes twice a day.
Girl, we're gonna get into it. Let's talk about it.
I haven't seen the slides.
I know.
I showed up and I said, "What are we talking about today?"
I didn't send them to you because I too.
I wouldn't have looked.
I too like to live dangerously.
I wouldn't have looked if you did send them.
Well, I appreciate the honesty, if nothing else. Again, if you do have any questions, comments, concerns, threats, or promises for either Kari or I, again, Kari, who had 7 new clients in a day, then feel free to text this hotline. If you're watching the recorded version of this, anytime you do text that is my number. So feel free to text me at any time to answer your questions. But let's get into it. So today we're talking about marketing yourself during AEP. And the big thing here is, like, your marketing can't stop. Like you said, right now for you, you said about 50%. Not even. You said, like, a handful of times you're actually writing AEP business. Everybody else.
5 new clients.
5 new clients.
Have been
and we're in November.
AEP.
That's nuts. That's nuts.
Yep.
People still are turning 65. People are retiring. People are looking for help out there. So, like, you can't. What ends up happening a lot of times during this season of our lives is that we put all of our eggs in the baskets of, like, appointments and getting, like, those taken care of. That we completely shut down energy to everything else, including marketing, including the relationship building stuff. So I want to offer you guys today just some, like, casual, like, things that like are not time consuming. So you can continue to be productive, but not get busy in the idea of, doing marketing.
My 2 days of seminars during AEP in Kansas City was not, I don't know if I would do that again.
Really?
It was, I mean, 2 days is just too much.
Yeah, because you stayed in Kansas City, or
Yes.
did you drive back?
So
and
I was
forth?
there from like noon. I mean, I guess it was really only 24 hours, but it seemed like 2 days because
Yeah.
by the like drive time,
Yeah.
I mean, I was there from like noon to noon. So really like
Yeah.
10 to
That's too much.
too much.
Too much.
But a little bit is worth it.
Yeah. So the first thing I was talking about was actually what Kari was getting into, which was your social media.
Oh, yeah.
I am a huge proponent that social media, particularly Facebook, and at this point now LinkedIn has now kind of climbed
And
the chart.
TikTok. I know. I rotate. So every day there's either a post on Facebook, LinkedIn, or TikTok, sometimes both.
Oh, that's a really good idea. Just to kind of like, each day.
And I've been
like a
doing
rotation on it.
teasers. So the last month I've done.
Kari, tell me more.
So on LinkedIn and on Facebook, I will put I've been doing client question of the week. So I take an actual question from my clients. And like one of the recent ones was, I'm going on a cruise. How will my Medicare cover me?
That's a really great question.
And I'll put that like client question of the week graphic with the question on LinkedIn and on Facebook. And then I'll say, follow my TikTok to find the answer tomorrow.
Kari, what a wonderful idea.
So some days I've forgotten to post the TikTok.
And then like the TikTok never comes and the people want the TikTok.
I haven't gotten any
The
complaints.
people need to know.
But that's been really fun because it's also been like, I like consistency. Mm-hmm. And I think it's been maybe 6 weeks now we've done that.
That's awesome.
So,
I mean, they do say the only thing worse than not having a social media account is having an inactive social media account. So what I do, I manage a few different Facebook pages. What I always do is I get my Sunday nights whenever I'm kind of like planning my week.
Yep.
And I do it every other week. And what I do is I schedule posts for the next 2 weeks. And so where like I'm being productive, it takes me to do about 2 weeks I do it for 3 pages. To do for 2 pages for that takes about an hour. It doesn't take that long. So that's why I put on here just some ideas for some things to do. I love the question of the week. I love that consistency. People start looking at that, becomes a part of your brand.
and I like didn't have to, I was tired of like thinking of content. And then I was like, it's
in front of
literally
me.
right here.
Yes,
like,
the
what are
content
my
is coming
clients
to me.
asking me?
Yeah.
And
that's
so I
easy.
I don't have to.
And you're doing it in video, like TikTok, obviously, but you're doing it in a video format. And that TikTok can be shared to your Facebook page.
Exactly.
So that's perfect. It's really easy. It's passable. And the thing that people get hung up on is like, well, you don't have to take professional videos. Honestly, the more authentic, the more human it is, the better results you're going to have. If it looks super produced and it's like all these cuts and all these edits, it looks like a reel. It looks like, it doesn't come across really authentic. So literally just doing like a Kim Kardashian holding up your phone and just talking like that.
Do you remember
Perfect.
I had a trial and error of that.
Yeah.
I had a like professional try to film me and I hated it. It didn't feel
you.
right, didn't feel comfortable. I like weirdly felt better.
And your people
It was
like
more
it.
conversational.
Your social media is designed.
But that was me. Somebody might like
That's
something
fair.
different.
Social media is designed. Your professional persona should be on LinkedIn, should be on your website. Facebook is designed for people to feel like they have a relationship with you. It's for you to build a relationship that feels one-on-one on a mass basis. So the more human you are, if you fumble over your words, you make a little mistake, you trip over something while you're walking, the more human you are, the more relatable you are. And that's why people are on social media. The other advice that I have is to make sure that you are paying attention to your current book of business through things like social media, your newsletters, other types of letters letting people know it's AEP, and of course, seminars are huge during this time of year.
Okay, I have to say this. I forgot about this. But I got a new client who called me. Well, she's not a new client yet, but she called me this week and she said, I had known her from the chamber 6 years ago.
She smacked me because I'm getting involved in the chamber. Go ahead.
She has her own business, and so she kind of gets this too, and I'm so glad she gave me this feedback. But after our conversation, she said, I have to tell you, I only remembered I remembered you because I keep seeing your posts on Facebook. She said, we haven't seen each other in 6 years, but she was like, keep up the post because that was the reason I remembered to call you.
Yeah, and again, like, it's your Facebook, you can't expect, okay, I made a post. Now the leads are going to start pouring in. No, it's the long game.
Oh, yeah, for sure.
It's brand building. The more people see your content, the more you become familiar. Familiarity equals trust. Trust will equal sales every day of the week. So it's all about just building that brand recognition, but not in like a time-consuming way. But yeah, again, when you're working with your current book of business, that's something that you really should, Good call. That is absolutely nothing.
We didn't have the chat open.
Yeah. That is something that you absolutely have to keep in mind with that, is to make sure when you are working your current book of business. This year, we are finding out that people are shopping this year more than they have in the last, 5 years.
I feel that.
PDPs going nuts this year. A lot of the formulary changes, a lot of premium changes, both really high and really low.
Going to survive.
By prayer and duct tape. But
I'm really worried.
Yeah. But again, and what's interesting about some of those changes is that it's happening on both sides. The feedback that I'm getting, you tell me if you're seeing it too. We'll talk about WellCare, because WellCare went from $16, $12, some states $20 to either 50 cents or $0, right? Depending on where you live. I'm hearing that WellCare clients who were already on WellCare are saying, get me off this plan. If it's going to $0, it must be going to crap. I don't want it. And then people who weren't on WellCare are saying, hey, get me on that $0 plan. I don't want to pay a lot for this. I'm not taking a lot of medications anyways. Get me on the cheaper option. It's almost like a complete switch.
I've had no one... It has definitely scared or concerned everybody that was currently on it. But nobody's said no. Because I think I reassured them.
You reassured them that they're okay. But you've had to, actively work with them. It's time that's not you selling a MedSup or Medicare Advantage.
I've had to confirm that it's just as good as it was before the $0 plan. Yes.
No, for sure. So make sure, again, you're working with your current book of business, letting them know, because if they're not hearing from you, they're hearing from their friends, their neighbors, their loved ones, the radio, the TV, that they need to be shopping and changing. So if you're not talking to them, I can promise you someone else is. Next, I'm getting so much conversation about kiosks.
Really?
I don't like how that word sounds, kiosks.
Yeah, I don't either.
But, okay, so Integrity launched their Walmart program. So right now, Walmart's offering two different programs. One through Integrity, the other one through Humana and IF, that IF company. So I'm hearing so much about people, and, there's been a lot of attention to kiosks. I have a love-hate relationship with somebody doing a kiosk.
I've never done one.
I think that if you are new and you don't have marketing referral partners, you don't have a current book of business, you don't really have a plan about how to get new clients, it's better than doing nothing, because you are building somewhat of a brand. Of course, if you're doing the Walmart program, you have to put out the Walmart logo, you have to put out the Humana logo. You have to be careful. So it doesn't do much depending on where you're located. My point of an idea of a kiosk is that you should either be there to take sales that day and not do follow-up appointments, at a DSNP, at a food bank or things like that. Or you should be there to build your brand and set appointments. You have to have a strong call to action. It's one or the other.
Could you set an appointment there, though?
You can, because it's a registered sales event. So you can set an appointment at a kiosk. You can set a follow-up appointment, but it does require the 48-hour waiting period. So you have to do that. But we're seeing a ton of this, and we are seeing some agents who are having a lot of success with it, and we're also seeing agents who are sitting on their hands. So whenever I talk about doing a kiosk, you have to be careful, because they can take a lot of your hours, and they're CMS registered events. So you can't just cancel them last minute. And you have to abide by the rules, and you have to abide by what you committed to. But they are nice for people who, again, they don't have a lot of marketing going on. Maybe they have new downlines that need to get their kind of cut their teeth and get there. It is good activity, and if you do it right, it can build your name. It can build your brand. We actually had United Healthcare in our office last week, trying to talk to us about what's going on in the field, what are our agents saying about us, and something that they brought up, what they're seeing a ton of success with, is actually people being in grocery stores. A lot of people will go to
kiosk in grocery stores?
Yeah, a lot of people will go to the pharmacies and go to the CVS's, the Walgreens. She was saying no, if you go to your small hometown grocer and set up a booth there. You get so much more foot traffic, and you could talk about like the wellness benefits and these flex cards that come with like, hey, we could help you pay for your apples.
Yeah, that would be
carrots.
smart.
So that might be something, again, it's not going to be part of one of these big programs, but like find your local grocer, get in there, talk to them and say like, hey, I can help your people actually pay for their food through some of these benefits.
You brought up United Healthcare, and this is not related to marketing, but it's a thought that's heavy on my mind.
Listen, I need to hear your thoughts that are heavy. Hand me your heavy thoughts.
I'm just really surprised at the amount of my clients who are like the stability of United Healthcare's plan. Even I was worried with it like not changing.
They didn't change. Other
And a few
carriers
benefits-
rolled up their sleeves.
Yeah. And I was expecting so many people wanting to change. Not a single one of mine.
That's
Not one.
good to hear and good to know.
Not
we
one.
had
We've talked, we've looked at other plans, but they're just like, I'm happy with it.
I'm hearing that pretty consistency. Well, UHC is a little disappointed that they're not gaining market share. In fact, they're losing it in a lot of areas.
In my area, they are not losing it.
That's good to
My
hear.
book.
That's good feedback. Because, like, again, like when you have, like, right now the big winner is going to be a carrier like Aetna for us.
Oh my gosh, yes.
Because they're paying for your golf. They're paying for your club. They're paying for your golf. They're paying for your pickleball. Like,
And maybe it's me. Maybe it's me.
I don't think it's sustainable.
But exactly. And maybe it's the way I phrase it. But I'm like, yes, those benefits are fantastic. But do you have your health insurance for golf? Or do you have your health insurance for like the medical stuff?
Yeah, yeah. I think the point is that you have to be able to talk about it, because you are going to be people there
for sure.
who are going to say, you know what, I don't know.
Somebody's getting their golf paid for. Why didn't you tell me about that?
Yeah, why didn't you tell me about that?
Yep.
Why can't, and some people are going to say, you know what, like, yeah, I'm willing to take a gamble or a risk to say this year, I just want to try this out. I can always go back next year. And that's okay. You just have to make sure that you have those conversations.
Right.
But it is nice to know that, like, this industry, the market is now kind of getting to, you know what, we value stability. And
I don't have
nice
a
to have
huge
that.
Medicare Advantage book.
Sure,
but I've
sure.
met with at least 20 people who are saying, I'm sticking with UHC.
Yeah, yeah. The last thing I wanted to talk about was actually going to be making sure that referrals, again, both for your current book of business and your alliances. That was a hard word to say. Your partners, your referral partners, making sure that you're continuing. Again, what the biggest feedback we hear right now is that, like, I know how busy you are, Kari. Like, I know you're really busy.
Yeah.
I do not, like, my friend, she's needy.
So many
She's
people are like,
probably-
thanks for squeezing me in.
Thanks
I'm
for
like,
squeezing me in.
no.
Yes. So like people are like, I would love to get you in with my friend Kari or my agent Kari, but I think she's really swamped. I'll see what I can do. No. You need to make, like, I'm saying you because you're here.
Yeah.
You're a great example.
Yep.
But like as with agents, we need to be like, no, like I am here. This is my Super Bowl. I love it. I'm prepped for it.
It's our tax season.
Send me your people. Send me your friends. Send me your loved ones.
So it's a good problem to have. Ran out of business cards the last month.
Yeah.
Because everybody always, I have them sitting right there on my
Yeah.
desk when I meet with people. And I always, I write on the back, I'm like, here's my cell phone if you need it. And I'm like, and here's another card if you have any friends or family.
That's
I
the way
always
you
give
should
them
do
2
it.
cards.
What I always like to say is, like, you should always, because we always say, again, I know this time of year is hard, but never leave an appointment without them having a follow-up appointment or at least a follow-up phone call that's scheduled. I know. And then you just write on your business card, you write their appointment on the back of it and say, here's this one, but here's another one if you need it.
I kind of do that. I have a spreadsheet.
I have a Kari. Oh, I need to get you this coffee mug. There's 2 of them that I really like. One of them is a
about
coffee mug that says, ooh, this calls for a spreadsheet.
Oh, yes.
I will get that for
Yes.
you. And then there was another one that says freaking the sheets. And it was an Excel spreadsheet. You'll get both of them for Christmas.
Oh, that's
I
so
love
cute.
it. But making sure, again, that you are continuing to meet with your referral partners during this time of year, that you're at least reaching out to them. You can do so in passive ways, like sharing their content on Facebook. They will see when you share their content. But there's ways that you can go ahead and maintain a relationship during AEP. And then, of course, never allude that you're so busy that, like, your clients feel uncomfortable to reach out to you.
I just had one of the Edward Jones advisors that I work with regularly. He emailed me this week and was like, I know you're so swamped. If you can do this for me, that would be huge. She said, I'm presenting to a group of like new Edward Jones advisors on Friday, and I would love to share your top 10 Medicare tips when I'm sharing your contact information. I'm like, well, yeah, I'll do that.
Yes, absolutely.
Yeah.
That's setting you up. And again, I know it's hard this time of year being like, I'm back to back appointment. Exactly. But it's like, but man, like it's
worth
the
long
hour.
term.
It's that long-term gain.
Yep.
All right, guys. Well, we promise to keep you guys high and tight and out of here during AEP and just give you the deets, give you the updates. I know you said you have 4 Zoom meetings today. Yep. Okay.
10:30.
So we got to get out of here. We got to wrap it up. You guys are pretty quiet today on the chat, but if you do have any questions, comments, concerns, threats, or promises, or you're watching the recorded version of this, again, that is my number. You can text me at any time, or if you do comment on this after the fact, we have people who watch this to make sure that your comments are getting answered. So please just let us have it. Let us hear it. And we'll continue to bring you valuable content throughout AEP every Tuesday at 10 a.m. And Central Standard Time, of course. And then, of course, make sure you're following our Facebook group or you're part of our Facebook group so that you just get updates on, hearing from other agents and you get updates about what we're hearing out there in the industry.
On the good stuff.
All the good things. And sometimes bad things. Bad things happen, and that's okay.
Compliance has been pretty good.
Compliance hasn't been bad. We're not hearing a whole bunch. I do know that they did release the 2025 proposed rules. There's some pretty big things in there. I don't imagine that a lot of them are going to come to fruition, but there's even something about like making HRAs illegal, making like bonuses during AEP illegal.
Oh.
So these are just proposed, but it's something that
I thought the carriers liked having those surveys.
Carriers love it.
Yeah.
CMS says, no, girl, not today. So again, those are just proposed. We are just in the initial sweep through of it. Our compliance officer, Chaylin's taking some time to look through it. So we'll keep you all aware of what they're proposing for next year's AEP.
Okay.
Awesome. All right, guys. So until next time, you all have fun.
Make money
And give impeccable service.